Have you ever opened your medicine cabinet and wondered whether something inside might quietly be harming your brain? Most of us trust whatever comes from a pharmacy shelf. Yet some everyday powders and pills, taken for years without a second thought, could be slowly rewriting how your mind functions. This video isn't meant to scare you, but to wake you up. By the end, you'll know which common medications scientists now link to memory loss, confusion, and even dementia-like symptoms. So stay till the end, because what you learn here might literally save your mind. Let's start our countdown. Powder number 9, Benadryl, diphenhydramine. Benadryl is the name almost every household knows. It's that pink, chalky powder doctors once recommended for allergies, colds, or sleepless nights. But here, the twist, research shows long-term or heavy use of diphenhydramine can raise the risk of dementia by up to 54%. That's because Benadryl blocks acetylcholine, a neurotransmitter essential for learning and memory. When the brain keeps losing this chemical signal, neurons misfire, and over time the result feels like fog. Forgetting names, losing focus, struggling to follow simple conversations. If you or someone close to you relies on Benadryl daily, don't panic. Just talk to your doctor about non-anticholinergic alternatives. Benadryl should never be used as a regular sleep aid. It's meant for short bursts, not nightly rescue. Let me know in the comments if you've ever noticed feeling mentally slower after allergy medication. You might not be alone. Powder number 8. Metformin, the lifesaver for millions living with type 2 diabetes. It helps control blood sugar by improving how the body handles insulin. But several studies suggest long-term metformin use can quietly drain vitamin B12 levels, leading to nerve damage and cognitive decline. When B12 drops too low, your brain cells literally lose their insulation, the protective sheath that allows thoughts to travel fast and clear. The result? Tingling in the hands, mood changes, memory slips that most people blame on stress. Doctors usually check sugar levels often but forget to test for vitamin B12 deficiency. So if you or a family member have been taking metformin for more than a few years, ask for a simple B12 test. It's quick, cheap, and can prevent years of hidden damage. Right? Checked my B12 in the comments if you'll make that call this week. It might inspire someone else to do the same. Powder number 7, proton pump inhibitors, PPIs. Omeprazole, esomeprazole, pantoprazole. These powders promise quick relief from heartburn and acid reflux. But when used for months or years, they can quietly rob your body of magnesium and vitamin B12, both crucial for brain health. A major 2016 study found that chronic PPI users had a 44% higher chance of developing dementia compared with people who didn't rely on them. Why? Because the stomach needs acid to absorb nutrients. Shut down the acid too long, and your brain starves of the minerals it needs to stay alert. If you've been taking PPIs daily for more than 3 months, it might be time to review your dosage. Sometimes lifestyle shifts, like eating smaller meals, avoiding late-night snacks, or reducing caffeine, can help more than another refill. Comment: acid control check if you're going to ask your doctor before your next dose. Small steps today could mean a sharper mind tomorrow. Powder number 6, statins, cholesterol-lowering drugs, atorvastatin, simvastatin, rosuvastatin. For millions of people, statins are lifesavers. They lower cholesterol, protect the heart, and prevent strokes. But recent studies reveal an uncomfortable truth. In some users, these powders may subtly affect memory and mood. Cholesterol isn't just a bad guy. Your brain needs it to build cell membranes and produce hormones. When cholesterol levels drop too low, it can disrupt how neurons communicate, causing mental fog, slower recall, and, for some, mild depression. That doesn't mean statins are dangerous. They save far more lives than they harm. Yet, if you've noticed unexplained forgetfulness or mood changes since starting one, bring it up with your doctor. Sometimes adjusting the dose or switching to a different statin helps the brain bounce back. Remember, health isn't just about a strong heart, it's also about a clear mind. Drop a "clarity matters" in the comments if you agree. Powder number 5. Anticholinergic drugs for bladder control. Oxybutynin, tolterodine. If you or someone you know struggles with urinary urgency, these medications may sound like relief in a bottle. But the same way they relax the bladder, they can also shut down important brain pathways that control memory and attention. Oxybutynin, for example, crosses the blood-brain barrier and blocks acetylcholine, the same neurotransmitter affected by Benadryl. Over time, that can lead to confusion, poor concentration, and, in elderly patients, symptoms resembling dementia. The problem? Many older adults take these drugs for years without knowing the risk. If you hear a loved one complaining of both bladder issues and memory lapses, connect the dots. They might not be aging faster. They might just need a medication review. Write "review meds" in the comments if you think it's time we all looked twice at what's inside our daily pill box. Powder number 4. Sleeping pills and sedatives. Zolpidem, esopiclone, and benzodiazepines like lorazepam or alprazolam. The world is tired, literally. Millions can't sleep, so they turn to powders that promise deep rest in minutes. But these sedatives, especially benzodiazepines, come at a heavy cost. They suppress brain activity, limit REM sleep, and over time, dull the brain's natural ability to calm itself. Long-term users often report feeling disconnected or emotionally flat, and studies show prolonged benzodiazepine use increases dementia risk by nearly 50%. When your brain depends on a chemical lullaby every night, it forgets how to sing its own. If you're using these drugs, talk to your doctor before quitting abruptly. A gradual taper, along with better sleep habits, like a dark room, no screens before bed, and regular timing, can restore your brain's rhythm naturally. Drop a "better sleep" in the comments if you were choosing your rest over pills tonight. Powder number 3. Antidepressants, tricyclics and SSRIs. Amitriptyline, paroxetine, sertraline. Depression is real, and these medications have changed millions of lives for the better. But like any chemical that alters brain function, they carry side effects that deserve respect. Older antidepressants, such as amitriptyline, have strong anticholinergic effects, meaning they block the same neurotransmitter that keeps memory circuits alive. Even some modern SSRIs, like paroxetine, can cause subtle cognitive dulling in long-term users. It's not that these medicines are bad, they can be life-saving, but the key is monitoring and balance. If your mood improves, but you start to feel mentally slow or detached, don't ignore it. Your brain chemistry might just need recalibration. Doctors often adjust dosages or combine lower doses with therapy, exercise, or mindfulness to reduce dependence. Because sometimes healing the mind means working with it, not just medicating it. Let me know in the comments if you believe emotional health deserves the same careful attention as physical health. Your story might encourage someone who's silently struggling. Powder number 2. Antipsychotics, quetiapine, risperidone, olanzapine. Antipsychotics were originally developed for severe mental illnesses like schizophrenia or bipolar disorder. Yet today, many seniors unknowingly take them for sleep disturbances, restlessness, or behavioral changes associated with dementia. This is alarming because these powders can dramatically suppress dopamine, a key brain chemical essential for motivation, memory, and mood. When dopamine drops, the mind slows, reactions dull, and personality fades, sometimes so gradually that family members barely notice until significant cognitive decline has occurred. Studies show seniors on antipsychotics for behavioral symptoms are 71% more likely to experience worsening cognitive function within just a year. And the risks go beyond memory. Stroke, falls, sedation, and even sudden death are higher among long-term users. The solution isn't always stopping the medication immediately, it's asking tough questions. Why was this prescribed? Is it truly necessary? Non-drug interventions, like structured routines, reducing noise, managing pain, and improving sleep hygiene, often work better and safely. Share your thoughts in the comments if you've witnessed this silent decline in a loved one. Awareness is the first step toward reclaiming clarity.
Powder. No one anticholinergic polypharmacy now. The most dangerous but often invisible threat to senior minds. Taking multiple anticholinergic medications at once. A situation known as anticholinergic polypharmacy. Imagine a senior who takes Benadryl for allergies, Oxybutynin for bladder control, and Amitriptyline for nerve pain. Each one alone may slightly affect memory. Together, the cumulative effect can more than double the risk of dementia within 10 years. Neurons starve from underuse, synapses shrink, and the brain's overall activity slows, creating a state that looks very much like Alzheimer's. But is medication-induced? The good news: this is largely preventable and reversible. A careful medication review, checking prescriptions, over-the-counter drugs, and even supplements can uncover hidden risks. Working with your doctor to taper unnecessary medications, switch to safer alternatives, or rebalance brain chemistry often restores clarity, focus, and energy within weeks or months. Drug-induced dementia isn't inevitable. With the right awareness and action, seniors can regain much of the cognitive sharpness they thought was lost forever. Now it's your turn. Which of these medications are you currently taking? Have you noticed brain fog, forgetfulness, or sudden personality changes after starting a new drug? Don't stay silent. Talk to your doctor this week about reviewing your medications. Your brain is resilient, but only if you give it the chance to heal. Drop your experiences in the comments below. We're reading every single one and replying with personalized insights. Sharing could not only protect your mind, it could protect someone else's too. Thanks for watching, and here's to a sharper, clearer, healthier mind for years to come.